nurse manager at Student Health, and I am happy to see you all today. So I'm just going to talk to you a little bit about Student Health and the services that we offer. And then, like Bree said, I'll answer any questions that you have at the end. So Student Health is located in the West Lawn building. We're on the west side of campus on Newton Road. The West Lawn building is next to the College of Nursing and right across from the Medical Research Building. Students can access us by either riding the CAM bus or the Iowa City or Coralville City buses. We have bus routes and stops right in front of our building. A lot of times they just walk to us or ride their bike, or we do have a parking ramp right next to us that they can park and then come into the building. Our clinic is a primary healthcare clinic, and it's strictly for University of Iowa students. We have board certified physicians and physician assistants in family medicine. We also have psychiatrists, we have a gynecologist, and we're also staffed with registered nurses, medical assistants, lab techs, and administrative staff. Our clinic is similar to any other family medicine clinic, probably one that you may attend. We do offer physical exams, job physicals. We evaluate and treat acute and chronic illnesses and injuries. We also see students for LGBTQ care, sleep issues, skin problems, sexual health. Our gynecologist can also perform pap smears. She also provides contraceptive education and management. She also does procedures such as IUD and Nexplanon insertions and also colposcopies. Our psychiatrist sees students for behavioral health and medication assessments. They also see students for mood disorders, OCD, and ADHD treatment. We also have a weight management clinic where students can come in if they want to lose weight or if they need to gain weight. We also see students for eating disorders. Our nurses staff an international travel clinic. So any student that's studying abroad or if they have an away rotation, if they're a health science student, they can come in and see a nurse, and we will provide education to whatever country they're going to, or and also immunizations and medications such as medications for malaria prevention and things like that. We also offer allergy injections. We don't actually have an allergist that work in our clinic, but we do work closely with students' allergists, and so we do provide allergy injections while they're here on campus. And then we also offer immunizations that are recommended by the CDC for our age group of students. We also see students to help fulfill their health science requirements. So a lot of things are required in addition to the MMRs for that. We have an on-site lab. We have a nurse line where students can call and talk to a nurse if they have questions or concerns or not sure that they need to be seen. And then we also coordinate our care with specialists at the University of Iowa hospitals and clinics. So if students want to be referred to gastroenterology or the rheumatology clinic or any clinic over at UIHC, we can also provide that for them. So our second location is in the Iowa Memorial Union building. It's called the IMU Nurse Care building, and it's located in the lower level next to the Java House coffee shop. That is just kind of a walk-in clinic. We don't require appointments there. We have a registered nurse that staffs that clinic, and students who are health science students can come in and get their requirements met there. Students can get vaccines there, flu vaccine, COVID vaccine. And if they have any questions for a nurse, they can just come in and sit down and talk with the nurse regarding their concerns. We also provide TB screening there for health science students that need it or anyone else that needs it for a job, and also for international students. And like I said, no appointment is required. They can just walk in during office hours. So if you're a student coming to the University of Iowa, you are required to submit documentation of 2 measles, mumps, and rubella vaccines. These vaccines are usually given in childhood, usually at age 1 and then around 5. You know, in order to get these vaccines, you might need to see your doctor. Some high schools have students' vaccination records that you would have submitted to them. So if you don't actually have a copy of yourself, for yourself, you can just see your doctor or high school and get a copy of that. Students can go on to our website. They'll need to create an account with MedProctor. It's an outside company that manages our immunizations for us, and then upload the records, and then that's how we get them. There's several ways students can access student health. We have an online portal through MyChart. They can schedule an appointment that way. They can also call our scheduling desk to make an appointment. If they have a question with a nurse or not sure if they need to make an appointment, they can call and talk to the nurse on our nurse line. And, you know, after discussing with the nurse, they can make a decision whether or not they need to be seen. We also have an email that students can email us, or they can just stop in to the IMU Nurse Care. So I talked about MyChart. MyChart is an app that we recommend that students download. University of Iowa Hospitals and Clinic is affiliated with MyChart, and so is our clinic. But it's a way that you can either schedule appointments, you can change your appointment, you can cancel your appointment. You do get appointment reminders if you use the app. You will also be able to view your lab results. As soon as they are resulted from the lab, you get an email saying that you have results to view. You will also have access to your clinic visits, the clinic note that the provider writes after your visit. Also your immunization records, if you've sent them to us, you'll have access to all of that information. So that kind of is a way for students to, you know, keep their medical records with them so that when they do leave the university, they'll have all that information with them. They can also send a message to their provider if they have a question or concern about something that was discussed at the clinic visit. Maybe they need a clarification on something, so they can send a message to their provider. And our providers are usually really good about answering those, and we do send out messages notifying students of their test results that way if they have MyChart. All students, if they take more than 4 semester hours, are charged a health fee. This is for, it's to cover for office visits here at Student Health, and it's placed on the U-bill, so you won't actually get a bill. It's just right with your insurance. There'll be a charge for student health fee. Last year it was $118, and I believe it's going up to $123 per semester this next year. So like I said, what that covers is unlimited office visits to student health, so we don't charge copays or anything like that. What it does not cover, though, are lab tests, vaccines, things like that that are done extra than just seeing a provider. So when those charges are incurred, we do bill insurance, and then whatever isn't covered gets put on the U-bill. So you'll never get a bill from us directly. It will always be on the university bill. Students are also required to have health insurance. The university does provide a health insurance plan through Blue Cross and Blue Shield. You can sign up for that. I don't know the cost, but if you call the benefits office, they can certainly help you with the cost of that. But if students want to sign up, they go through MyUI to do that. We also have a group called Student Wellness that works closely with student health. This group offers group workshops and programs in fitness, nutrition. They have a dietitian. They also offer programs on stress management and sleep, smoking cessation, sexual health, and alcohol and drug use. They have an office here within our clinic, and then also at the CRWC, which is the Rec and Wellness Center downtown. All of their programming is free to students, so they should definitely, you should take advantage of that. If you don't know how to do CPR, you can get certified in CPR free of charge through them. Student Health does have a website, and I would encourage students to log on and look at our website. It talks about our services and our hours. There's a section on what to do before your visit. Now that we have, now that COVID has come along, we've done a lot of our visits through Zoom, and MyUI also has, MyChart has an option where you can do virtual visits with your provider here and also at the University of Iowa hospitals and clinics. So there's some information about, how you need to get ready for those types of visits. So that has some good tips in there. Any news, especially about COVID or anything else going on campus, is also located on our website. Students who are health science students can also locate their requirements and the forms that they need on our website. And there's some other health information for students to read about, and parents too. So that's all I have for now. There is a couple things that I'll say about COVID, because I'm sure that's on everyone's mind. Masks will not be required on campus or in campus buildings in the fall. At least that's our guidelines right now. You do have to wear a mask though if you ride a CAM bus. You do have to also wear a mask if you go into any medical facilities. So that would include our clinic here at West Lawn and also at the IMU. And then any clinics affiliated with the University of Iowa hospitals and clinics. So it would be a good idea to still bring a couple masks with you when you come to campus, because there will be opportunities that you'll need to wear it. And then the other thing that I would just strongly urge students is to get vaccinated for COVID-19. We do offer the vaccine here at Student Health. But if students can get vaccinated at home before they come to campus, that will just help us all in the end. And we can all get back to our life the way it was before, hopefully, if we're all vaccinated. So that's all I have. If you have questions, I'll be happy to answer them.